Tough act to follow, but if anybody can do it, probably Senator Steinberg can do it. While he's coming up, I'm going to just share a little bit about Senator Steinberg. Hello. Very nice to have him here. We all know Senator Steinberg as a champion of mental health, the author of the Mental Health Services Act, which has made such a difference in our state, both in how we deliver services and in getting services to people who would not otherwise be getting those services. But I want to tell you a few things about him that you may not know. And I really have to ask them to start making this print a little larger. Hard for me to see. So besides being the President Pro Tem of the California State Senate, I think you should know about a couple of awards that he's won, which I hadn't realized until I started reading this, and it's important to kind of understand the breadth of issues that he deals with. So mental health is just one of the issues that he deals with. He also, in 2010, won the Kennedy Library Foundation's John F. Kennedy Profile and Courage Award, which is the nation's most prestigious honor for elected officials. He also won the California Journal's, this is a funny name for it, but it's called the Mini Award, which recognizes legislators who represent a pattern of conduct and outlook and demeanor that exemplifies the best kind of public service. The magazine also named him the Assembly Member of the Year in 2004 and also honored him as the Assembly's top member in the categories of integrity, best problem solver, and hardest working. So let me tell you some of the other things he's done. Senator Steinberg has earned a reputation for being unafraid to confront seemingly intractable challenges. For example, in 2009, he led a successful bipartisan effort to pass a momentous, quote unquote, momentous water agreement, which implements landmark improvements and investments in the Sacramento-San Joaquin Delta, the heart of California's water supply system, and enhances water reliability for all Californians. Now, if you live in this area, you know what a struggle that must have been, because there's nothing that is more divisive and difficult to deal with than water issues in California. And the differences between Northern California and Southern California, we could probably enact that right here if you're interested in seeing another drama around the water issues in this state. Then SB 375, which was signed into law in 2008, as another landmark bill that will combat urban spread and long commute times while encouraging efficient development by linking land use decisions in transportation and housing to green gas reduction goals. Again, another easy issue to deal with in California, right? No problem. Glad you could handle that one. The Los Angeles Times said it marks the first time any state has attempted to tie greenhouse gas reduction to transportation funding and regional land use planning. Senator Steinberg's also been a strong advocate for children as well as mental health issues. He authored legislation to focus additional education resources on high poverty schools and make them accountable for improvement. He's authored several nationally recognized laws to improve the state's foster system, including measures to improve provider accountability, educational consistency, and placement stability for children in foster care. And then, of course, we all know about the work that Senator Steinberg has done around Proposition 63, authored that, really pushed it around the state. And I remember when this was up, the senator said, I'll go anywhere, anytime to talk about this, because I think it's that important. And we all really appreciate that. And I will say one last thing before you come up, and that's that in our nation's capital, there's a lot of conversation in the wake of the tragedy at Newtown about what to do. There's a lot of discussion, and we see it in the news every day, around what should we do about guns. But the other part of that discussion is what should we do about mental health. There's a lot of concern. People understand that mental health services have been cut all across this nation during our recession. The funding is less There is less of a framework. The feds really haven't taken any kind of a stand around what should mental health look like in this country. And I will tell you, I had the privilege of accompanying Senator Steinberg on a trip to Washington where he was such a champion for mental health, really pushing what is important about the Mental Health Services Act, what is important about prevention and early intervention, and how that can really be a framework for what the nation does in mental health services. So we're very privileged to have him here today, and I just want to say you're probably our secret weapon in Washington. So please, Senator Steinberg.
Thank you very much, Sandra, for that nice introduction. I'm a little worried about where I put the coffee because I watched Marco Rubio on Tuesday night, the State of the State, and he had to kind of reach over, and I'm a little worried about a YouTube moment. But we will work it out. We will work it out. And if I do lurch this way, please, you can all pause. Wonderful to be with you, to be with dear friends. And Sandra, I, through the years, we've known each other, but really it was Washington 3 weeks ago after the inauguration that we really got the time to spend together, advocating together with Diane Van Maren of my staff. And what a great honor and pleasure it was, because I have a little bit of the sizzle, but you definitely have the substance and the sizzle. And I don't even know if I have the sizzle, frankly, but your knowledge and history and passion is really something. And that's true of so many. I see so many people who I have had the pleasure and privilege of working with over the course of so many years. Jennifer Clancy, who was our executive director of the OAC in its formative years, and what an interesting time we had, and it has led to a friendship, a real friendship, which is most important. Look, I am here maybe to tell you a little bit of a story, and then to talk about what we may want to do together. And I appreciated Sandra's recitation of that bio as well. I actually wrote it, which, just kidding, it's an old joke. The more complimentary it is, I say I wrote it. I was thinking about Mark Twain and the water issue. It's really true about water. I was a Northern Californian who decided to son. I have no idea why, because it's the least popular thing for a Northern California politician to do, and it reminds me of the Mark Twain line, which was just so true. He says, bourbon is for drinking, water is for fighting. And I certainly learned that in 2009. But I'm now in my 18th year of public service. And I have been a very lucky person. I have had the pleasure and the privilege of working on things that I care about. And I never could have imagined, frankly, that I would have the opportunities that I have had to serve the public. And when I look at my own journey, I would sort of divide it imperfectly between sort of the tale of two different times. One was the time prior to my becoming the leader, where I had the freedom and the ability to sort of take on causes. And not that I was unburdened by the larger responsibilities of governance. I always felt that strongly as well. But when you're not the leader, you can take on mental health and foster care and education resources devoted more to low-income students and regional planning. And I had a ball. And, I think got a lot done along the way. And of course, nothing more important in my life or in my entire public service than working on the mental health issue. Nothing. Because I believed back then, and I continue to believe, that mental health and substance abuse, but mental health and substance abuse, especially mental health, is the under-attended to issue of our time and in our society. It is, in fact, untreated mental illness and failing to pay attention to mental health in the most positive of ways. The consequence of our doing so is profound. We see it in every walk of life. It knows no artificial boundaries that otherwise divide society. It knows no economic boundaries. It knows no racial, ethnic, socioeconomic boundaries. It knows no community boundaries. It knows no gender, sexual orientation, or age boundaries. It affects everyone. And yet, we know that for a variety of reasons, our movement, your movement, has been, and in many ways continues to be, a struggle. Because for every great advance that we make, and certainly Proposition 63 is the most significant advance in mental health treatment and wellness in the country in many decades. Name another state or any other government that just decided, through a ballot initiative nonetheless, to devote $1 billion a year to prevention, early intervention, and housing, and whatever it takes to help people recover. Despite all of our gains, there is still tremendous unmet need. Tremendous unmet need. And so, to fast forward, after 2004, I sat out for 2 years because of term limits and decided that if I was going to come back into public office, because I had the chance to run for the state senate, that I was going to come back. I didn't want to be the kid whose face was outside the window pane of the candy store, kind of looking in and wondering what all those leaders were doing on the inside. If I was going to come back and spend the time and the energy, and it's wonderful, but there are a few downsides to serving, that I wanted to be in the room. And so in 2009, I was successful. 2008, I was successful and was elected by my colleagues to be the leader. It may have been a great statement about me. It may be that nobody else wanted the job. I'm not quite sure, because certainly what occurred in the months, really the month after I raised my right hand and took that oath of office, was historic in California, not in a good way. The budget deficit ballooned to $42 billion out of a base budget of $100 billion. Then I described the numbers as absurd. They were absurd. I mean, unimaginable. How do you deal with that? And how do you deal with it in an atmosphere of extreme partisanship, where most of the members on the other side of the aisle had signed pledges saying under no circumstances would they ever raise a tax? Well, for the past 4 years, between 2 governors and a number of legislative leaders, and I'm frankly the only one still standing from 2009, we were able to, with the worst imaginable choices, get through this. And mental health was not immune from the cuts, unfortunately. We took over $800 million of MHSA money, very reluctantly, to help fill the general fund gap. It was one time, but it was still $800+ million. We've seen cuts to EPSDT and cuts to Medi-Cal managed care, and the system, which was already underfunded, has, of course, suffered even more, even as the Mental Health Services Act is generating $1 billion or more on average every year. But the good news is that after 4 years of struggle. And it wasn't just mental health, of course. We eliminated dental care for low-income adults. Yes, down with that. I realized the impact of that decision when I took a Saturday visit last September out to Cal Expo in my district for the California Dental Association's annual dental fair, where I expected to have a cup of coffee and thank the dentists for volunteering their time. And what I saw was something I will never forget: lines of people around the Cal Expo, the cavernous Cal Expo, one of the buildings. People in line who had not seen a dentist in years. And they weren't there, by the way, to get a teeth cleaning or a checkup. They were there because they had untreated dental abscesses and root canals, and people who had lost their teeth, and people who were afraid to even think about re-entering the employment world because they had lost all of their teeth and they were insecure about their physical appearance. Very real across the board cuts. And yet, in November of this past year, 2012, with great leadership from the governor of the state of California, in partnership with the legislature and stakeholders, and I now want to recognize Rusty over there, Rusty Seelix, my friend and partner in all things Prop 63, who really went out and helped raise money for Prop 30 and made sure that the mental health community was part of the cause. We passed Prop 30, thank God, and now we begin 2013 with, can you believe it, a balanced budget in California. Yeah. And there is a great sense of relief, a great sense of commitment that we don't want to go back to where we went. Not all of it, by the way. In fact, most of it was the, quote, fault of policymakers. California suffered the worst end of the worst recession in the nation's history, in the world's history, at least since the Great Depression. But we begin this year now with a balanced budget, with a renewed sense of confidence. I just returned from New York City, and a couple of weeks earlier, of course, I was with Sandra in Washington, D.C., and people are beginning to notice that while Washington is a bit dysfunctional right now, at least the ability of Congress to get anything done, here in California, 4 or 5 years ago, they were looking at us as the laughingstocks. Now they're looking at us as a potential model. How'd you do it? Well, geez, it isn't rocket science. You got a budget deficit, you make necessary and painful cuts, you raise some revenue, yes, you raise some taxes, and you create stability, and then you have the opportunity to think about how to prudently reinvest and put back and build upon what we know works. And that now leads to, I guess, chapter 3 of the story, because I have this thing that all of us have who get elected to the legislature. It's called political mortality, otherwise known as term limits. I have 1 year, 9 months, and 15 days left before I term out. Who's counting? And I am still the leader and anticipate that I will be the leader of the Senate until the end of the 2014 session. I take nothing for granted, but it does help that I was able to lead an effort to achieve a supermajority of Democrats in the state Senate. My colleagues seem to like that. And so here's what I know, what I feel, and what I'm beginning to say. I'm going back to my roots. I'm going back to mental health. I'm going back. Because for a number of years, it's not that I wasn't involved, it's just that I was occupied by a few other things. And now that we have a little stability, and I feel this clock ticking, and I recognize that our work is so far from done, I want to do everything that I can in my last 2 years to help fill the holes, to help build back, to help build upon that which what we have created together. I'm so proud of this community and the OAC and all of the providers and the counties, Pat Ryan, everybody who, again, in the most difficult of times, have made this act almost 10 years now into its implementation a great success. And I say that without apology. But I know this. We have some problems. And here's really the problem. There's great frustration because there isn't enough money. Money isn't the cure to everything. Sometimes it's systems change. But we don't have to create systems change. We have to keep implementing the systems change that we created here in California. But we don't have to start anew. We have the national and international model for providing mental health services to people. It is prevention, early intervention, early screening, school-based services, stigma and discrimination reduction, expansion of suicide reduction hotlines and other services, university, community college, campus-based mental health services. We've got it. We're spending hundreds of millions of dollars on it. Each county innovating in its own way. I've seen all the models. I've seen the early psychosis screening project in Sacramento County in which 1,300 people between the ages of 12 and 25 are getting screened because of family history or referral from a school or a family member, who are getting the help early so that they don't have that first break when they are a freshman or sophomore in college and end up in the system. We're doing all of that and so much more. We have 60,000 people in full-service partnerships throughout California. Heroic. I tell the story, I mean, we all know Nathaniel Ayers, the Steve Lopez friend who was the subject of a wonderful book and a movie, The Soloist. We're helping 60,000 Nathaniels, 60,000 unnamed people, people who now, to one degree or another, have regained their lives and their hope and their dignity. We have an incredible client network here that continues to be role models for what recovery is all about. And I'm so proud to work with you. We have got it, but yet there is frustration because while we've gained $1 billion a year, we're losing, Rusty's estimate, $750 million a year out of the core system when you add up all of the cuts. There's great frustration because there isn't enough. There's not enough resource to be able to help everybody in need. I hear it. I hear the family members. We all hear the family members. Everybody knows somebody. The person who's even well-educated and even relatively okay financially, who doesn't quite know what to do. Or those who don't have the means, who have to sit on a waiting list for one of the best evidence practices. The fraying of the core infrastructure around clinics, and there aren't enough hospital beds for those who actually need them. So I'm not going to talk, and Diane said to me, and Sandra barely mentioned, I don't want to talk about Sandy Hook. I just did, darn it. Because I don't want to get away from this violence, mental illness connection. That's not right. And there are people who would, and there are people who would use it in a very cynical way. A very cynical way to say, well, don't do anything about this issue, but do something about mental health, but then they'll never really actually do anything about mental health. But sometimes there is a moment, sometimes regardless of whether or not we choose to talk about something or we don't like the way some people are talking about an issue, there's a moment. And this is a moment, because people are at least now giving lip service to the idea of funding mental health services. A lot of lip service. I love the president, $150 million nationally for coming out of the Biden Commission for Mental Health Services. Are you kidding me? Are you kidding me? For the country? That's not enough. But that's what happens everywhere when people don't know and don't understand that there are actually proven models out there that save lives, and that, frankly, especially when it comes to the early screening part, is both morally correct for us, but at the same time can help answer the political frame around the Sandy Hook issue. So what do we do about it? Well, we're trying to plant seeds. We were back in D.C. I was back in New York this week meeting with Mayor Bloomberg's top people on the subject matter. We have to organize. I know that there is federal legislation now. We have to meet with the Republicans. I met with Kevin McCarthy, who's my old friend from the Assembly, who is now number 3 in the House Republican leadership, and talked to him about cost-effective strategies to help people. He made no commitment, but he seemed to be interested. Well, how do we create an undeniable force? How do we make sure that our friends and our partners in Washington, D.C. don't get away with $150 million worth of peanut kind of resources to build MHSAs throughout the 50 states, or at least the structure and infrastructure for the MHSA throughout 50 states of this country? We have to be loud, we have to be organized, and we have to educate policymakers about what we've done. But I know we can't leave it just to the federal government as well, because in California, we may have some opportunities as well. And of course, the biggest opportunity is the implementation of the Affordable Care Act. Now, while I just maybe took a little dig at, I didn't mean to take a dig at the president, he deserves historic credit for the most important piece of healthcare and social legislation in 50 years in this country, the Affordable Care Act. California is set to receive between $2 and $3.5 billion. And we estimate that a significant percentage of those newly eligibles, as we call them, are going to need mental health services, and they will have mental health services as a result of that expansion. That is huge. But where there may not be a whole lot of new money, it seems to me that it is incumbent upon all of us to get creative here. For example, can we take 1% from EPSDT, the federal Medi-Cal money that flows to California, 1% or more, and actually take it and invest it in school-based early screening programs? Can we look at 3632 funding and see if we might create a partnership or a match, $1 of 3632, $1 of MHSA prevention early intervention funds put together to dramatically expand school-based mental health services and early screening programs? Can we find other funding streams that we haven't identified and free them up to pour into our strategies? Can we fight for additional state general fund money? There are going to be surpluses in California. The legislative analyst tells us there's likely to be billions of dollars of surplus. And so the governor has rightfully said, in fact, I talk to the governor frequently, and I would say in 90% of the conversations that we have together, he says two things. Hello. And that's nice. I like that. I say hello back. And then the second thing he says is, Darrell, restraint, restraint. And I get the message. But what if we realize $4 to $5 billion worth of surplus in the next several years? What if we said that we took a third of that surplus and we put it into a rainy day fund? What if we said we took another third and used it to pay down the wall of debt? And what if we took the third and said we are going to invest it in mental health and dental care and investments for people most in need? That's what I want to do. The money's not fallen from the trees here, but we have opportunity. And we shouldn't be shy. We should not be shy as we travel back to the nation's capital. We should not be shy here in the nation's largest state capital. We have to be aggressive about putting together a reasonable package that begins making up for the loss, filling some of the holes, ends some of the frustration, and allows for our mental health system to grow in the way we know it must to help more people. And so let me end, and I'm happy to answer any of your questions if you want to do that. On a little bit of a discordant note, no, not discordant note, but I want to talk about an issue that's hard to talk about. And I've talked to Sally about this, and I've talked to Rusty, and I've talked to Sandra, and I've talked to others about this issue of Laura's Law. Ooh, God, the speech was going so well. And then he had to bring that up. I want to talk about it because I have been, like you, very staunch in my belief that while the LPS Act exists and that there are laws and provisions for people to be in hospitals and are under involuntary care where they must, that ought to be at the very, 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 very end of the continuum. And that you cannot, why is it that people who talk about mental health, work on mental health, beyond a lot of the folks in this room, immediately go to those issues whenever the question of mental health care is brought up? It's frustrating to me. When I went back to Mayor Bloomberg's office 2 days ago and met with his top people and presented our national framework and talked about Prop 63, they're very interested in it. And then they immediately went to Kendra's Law and what are we going to do to make sure that, and I had to steer them back. And they kept going back, and I kept going back, and it was a struggle. And so we've had this issue of Laura's Law, which Rusty and others know. You worked very hard, and we worked very hard to make sure that while the bill did pass, that it had all of the safeguards and protections, I think, that we could insist on, including the fact that it could not be used unless and until the individual, you can show that the individual has been offered the full array of voluntary services for a long period of time, but before you ever got there. And so then we passed Prop 63, and the regs were written in such a way that at least just created some question in the counties about whether or not they can use Prop 63 funds for Laura's Law. And I have come to the conclusion that, number one, Prop 63 should never be used for anything unrelated to mental health treatment. should never be used for conservatorship, or should never be used for the legal process, should never be used for the court, should never be used for any of that. The resources are too precious, and that would be a violation of our act. But on the other hand, I'm not sure that people should be denied the treatment portion based upon their legal status. Based on their legal status. And I think that is consistent with the act itself. But there's another reason why I think we together, and this is the hard part, need to get beyond this and find a way to make peace in the way that I suggested. Allowing the treatment portion, and only the treatment portion, to be used at county discretion and provider discretion for the treatment portion of Laura's Law. We cannot afford to be divided as mental health advocates in this state and in this country. We can't afford it. It's hard enough. It's hard enough swimming uphill. We need more advocates. We need more people fighting for funding. And you know that the vast lion's share of the funding is going to go towards the model that we advocate, that we fight for, and that we know works. We are always going to be at the bottom when it comes to the political priorities. And yes, there'll be people who come after me who will fight for this, but there aren't enough. We need to build a broader coalition. I feel this in my head and in my heart. We need the hospital association. We need some of the advocates who believe that there is a place for this Laura's Law. We need advocates from the law enforcement community to fight for more funding. We'll win the policy battles, and we'll make sure that any of these kinds of laws are done in the right way with the right balance, just as we did in negotiating out Laura's Law. But we cannot continue to have editorial writers, advocates, politicians continue to allow a mental health community that already has a tough enough time because of stigma and because of all of the other challenges in getting more money. We cannot afford to allow these issues to have us divided. So I hope that I have enough goodwill and history to be able to say what I just said and to actually act upon it, because it comes from a good place, and it comes from my desperate desire, and I know your desperate desire, to see more people get help in the right way. Sometimes the most important thing is not being right. Sometimes a more important thing is to never violate your values or your conscience, but to find ways to work together with people you may have disagreements with for the larger cause. And the larger cause to me is billions of dollars more for people living with mental illness, to help more people, more families, to keep more people out of the system, to invest more money in prevention and early intervention and housing. That's the larger cause. And together, if you don't give up, I won't give up, and we'll do great things together. Thank you. Thank you for having me.
We have a microphone there, and usually there's one over there, but maybe it's hidden. There is one. Okay, so there's two microphones. I would invite you, if you have either questions or comments for the senator, this is your opportunity. So go right ahead.
I think there's, the mics are about a little behind the pillar, but I can see you, so.
Well, they're mobile. So
oh, we're over here, too.
Okay, there we go. I'm old enough to remember Frank Lanterman, and of course, there was Bruce Bronson, who was the new Frank Lannerman. There may have been somebody in between. And then you were the new Bruce Bronson, and
yes.
you've done a wonderful job.
Thank you.
No question about that. Yeah, you can give him a hand. So I'm going to ask the question that people whisper about in corridors. Who's going to be the new Darrell Steinberg once you're termed out in terms of mental health? Who do you think is going to be the new leader of mental health in the California legislature?
Well, there are a number of candidates for the papacy. I'm Jewish, you know. So there you go. No, it's really interesting. Jim Bell from Santa Clara, who's certainly a guy who will carry on and fight and lead, came to me maybe a little bit gingerly asking me if I would mind if he started a mental health caucus. And I'm sure he was maybe a little worried that, you know, since I'm a guy identified with this, that, geez, why would he lead it? And Jim, I said, thank God, yes. Start a mental health caucus in the legislature. I'm happy to be a rank and file member. And you know what? He had 8 people show up to the first meeting earlier this week. Unbelievable. At our Senate caucus retreat, and I think only 30% of it was based on my prompting, when we went around, I had every member go around and state their priorities for the year. And I would say a good third of the membership talked about mental health funding as their priority. And they talked about personal stories, a family member or some other way they've been touched by the issue. And so I don't know, certainly, again, you know, Jim Bell would be a leading candidate, but I would maybe think about it as not trying to find a single champion, but the goal maybe ought to be to make this issue now so compelling, the impact, again, of our failure to address it so compelling, that half or more of the membership says we need to do more here. That's the way I would look at this.
Hi, Senator Steinberg. I want to tell you that I'm asking these questions because you truly are a hero to many of the clients and the amazing things you've done by championing MHSA. But I did have a couple of thoughts that came up while you were speaking that I wanted to just see how you would think about this. One was, as you spoke about the shortage of hospital beds, are you thinking about effective alternatives so that we're looking at a future system that's not about more hospital beds, but about more crisis respite centers, more peer mentoring programs, more alternative things that are really helping people? So I'd love to hear that kind of mention in your speak, because you're...
Well, let me, if you give me an opportunity, I'll talk about it briefly right now, which is what's happening in the hospitals now is a disgrace. It's not their fault, but it's a disgrace. People coming in on, 5150s by law enforcement, and then, sitting or lying in the hallways of emergency rooms for 3 or 4 days in a row. That's terrible. It's terrible for the people, obviously. It's terrible for the hospitals themselves. And so when I talk about coalition building, I think we need to work in good faith, and we will this year, with the hospitals and with you and with others, on building a standardized, or at least to scale, triage system so that people can leave those emergency rooms into residential or into crisis residential, into a full service partnership kind of a program. We've done some of this. I know over the years that San Francisco, I know, out of SF General has had social workers in the emergency room, but we're not doing that across the board. And this is an issue that's impacting emergency rooms and people throughout the entire state. So absolutely, absolutely.
Thank you. And just the other piece of that, one simple program we did in Alameda County was called the John George Mentoring Program, in which peers partnered to provide peer mentors to people being released from the hospital. And they actually, the data shows that the people that were released with the accompaniment of a peer mentor stayed out of the hospital 72% longer, which was a great cost-saving measure. But yes. I mostly want to make my other point, which was, what was my other point? Sorry.
That's okay.
When you spoke about Laura's Law, of course, and funding the treatment within Laura's Law with MHSA dollars, I can see the practicality of that from a certain viewpoint, but what I'm very concerned about when I hear that is that right now the emphasis in MHSA on voluntary services and on really increasing effective outreach and engagement to offer services to people based on having mental health services that are so well done and so effective that people actually come to them because they do get help. I would just really hate to see that emphasis taken away, because once we're funding forced treatment, it takes away the motivation to really do that amazing work of figuring out how to be effective in engaging people.
Well, and I appreciate and completely respect the concern. We can't let that happen. We can't let that happen. All I'm saying is that for the reasons that I articulated, we shouldn't make it a prohibition on the treatment side. And I understand it's difficult and controversial, and we should debate it, and we will as friends and as people who are in this together. But I am sick and tired of not being able to get more traction for more funding, for voluntary services, for peer mentoring, for all of the things that we know work, because this issue constantly gets in the way. That's how I feel. Thank you.
Senator, thanks for your time. And I appreciate and have taken great interest into your letters and to Vice President Biden. I have a two-part question.
I call him Joe, by the way.
Yeah. So do I. And I guess we'll be looking for that white smoke over the Capitol sometime soon. One is, what has his response been? And have you personally had a conversation with him? And two, how do we keep steering the conversation away from consumers being victimizing people, individuals, to be that of victims of crime? And it's not talking to people in this room. It's holding the media accountable. It's holding reporters accountable. I am so tired of this gun safety debate being laid on the hands of people like me, an individual who happens to have mental illness. Appreciate any and all comments you have.
Sure. We met, our delegation met with the Vice President's Chief of Staff and top policy advisor back in Washington. This was the day after the inauguration, so the Vice President was not able to see us directly. They were at once very receptive, appreciative, but they were also realistic. They advised us to focus as much on the Affordable Care Act as possible, to look at, again, ways to create flexibility and funding streams within the ACA. They didn't hold out great promise of a lot of federal discretionary dollars for what we want to do. We didn't take that as a slam door in any respect, but they were very helpful, I would say. In terms of the stigma issue, my answer is that we have to continue to be forceful about telling the MHSA recovery stories and the stories of and the approaches on prevention and early intervention. We have to tell them, and this is, a great frustration. And I feel like I become like a scolder and too negative, and so I don't want to do that. But Lord knows we've tried, and you've all tried. But the media, we have to keep trying. But they like the controversy more than the good story. I was in LA for the LA's MHSA 5-year housing anniversary, and it was unbelievable. I mean, the stories and then the pictures of all the projects throughout Los Angeles. I mean, it's massive. Zev Yaroslavsky, I was there, all the big names, you know. And there was no media. There was no media. It's like I could barely get through my speech. Where's the media? I go, you don't have to cover what I say, but cover the success here. We have to keep trying. Just have to keep trying. And there's some breakthroughs, you know. We've got the radio show with the OAC. There has been more press, some more good press. I think at the local level, a lot of the local papers write about the MHSA programs, but, you know, we need a Steve Lopez or another champion to sort of tell the stories of as many of the 60,000 people as they can cover, and we just can't give up on that. But that's the answer to me. Yes?
Senator Steinberg, thanks so much for acknowledging some of the difficult funding decisions the legislatures had to make. While we have that great revenue from MHSA and been able to build new programs, a lot of our core funding has gone down in 1991 realignment, as well as some of the monies that the legislature's taken. My former mental health director used the analogy that we were building a new porch on a crumbling house. And we still have a lot of costs and important funding that we need for our basic program. And now with healthcare reform and the Medi-Cal expansion, the governor is talking about taking money from counties to help pay for that expansion. So I appreciate your saying you want to reinvest in mental health and dental health and so forth, but the governor is talking about taking at the same time. It's sort of the same situation again. And I just want to make a suggestion that as the legislature considers that you think about reinvesting, helping the counties reinvest the savings that we get from not paying for indigent health care into some other programs. We've lost a lot of money in public health, so we need more money for primary prevention, which is going to save money in the long run. We need more money for drug treatment, because when you realigned drug Medi-Cal, it capped the amount that we can spend on that, so you put the counties in the positions of actually restricting access to substance abuse treatment. So I'm hoping that you could see a reinvestment there as well, leaving that money with the county so that we can reinvest that in our local programs.
I think you have been listening in on some of the meetings I've been having in my office, actually, because, I mean, this is why, respectfully, we have two branches or three co-equal branches of government, why we have the executive and the legislature. The governor's put out a proposal. The governor's very popular, and he's a great governor. And, you know, I always say to the governor, we will have disagreement, we'll never have dysfunction. Never have dysfunction, because we have common goals. But on the disagreement part, that's going to be one of the real issues in the whole healthcare expansion debate, because he wants to soak up all that county realignment money, you know, and he has a couple of different ideas for how to do it. We understand, and I think the counties understand, that there may be some obligation down the line to help here, because we don't know the long-term costs to the state of Medi-Cal expansion, but we're going to, our negotiating position and our fight is going to be to make sure that, one, there's enough money in the counties to take care of the residual populations, the undocumented immigrants and the others who still need help, who won't have health care coverage. And then you better believe I'm going to look for a little piece of it to do what we want to do to patch the holes and to invest more in the mental health system. That's going to play out over the next couple of months, and that's why Diane and we all want to be creative here, right? How do we, if our goal is, I hate to throw out a number because if our goal is X 100 million, X, how are we going to come up with that money? Not going to just be, you know, through a general fund appropriation. We're going to have to look at the real, you know, some of the realignment dollars, EPSDT flexibility at 3632, match kind of approach. I mean, we're going to have to look at a bunch of things, and then you add it up, and it may get to that number that we can say we are investing in MHSA and its programs. Hi, Kristen. Hi. Oh, go ahead. Hi, Steve.
I was looking for a handheld mic, and so I was standing back there. I just wanted to say, you know, Senator, you know very well that I've been a supporter of the work that you've done and enthused back since 1999.
Yeah.
Maybe 2034 and on. But I will tell you that for all of my hero worship of you, and I really mean that, I'm despairing right now about this Laura's Law issue that you brought up. And part of the reason is that, and I've heard your reasons, and I understand them, but just for the same reason you talked about when you were in New York, people kept going to Kendra's Law, and you kept pulling back, Kendra's Law. And I don't know that you can turn on Laura's Law with a dribble. If you turn it on and fund it, it's going to be like the Kendra's Laws. And a lot of people, they don't really understand how patient, persistent, non-threatening outreach works, and they're going to go there, and it's going to be a flood. And I'm really afraid of that. I also want to say that there is a real problem out there. I think for good or ill, as MHSA rolled out, a lot of the people, particularly the family members that have people living at home, they frankly got left out. They supported Prop 63.
Right.
And I thought it was a really wonderful thing, because here are family members, you know, the traditional rivalry between the family members
Right.
and the consumers. And they were saying, not, I want my son or daughter locked up in the hospital, but I want my son or daughter to have services that can get them into recovery, get them a job, et cetera. And what a wonderful change. And so they campaigned for this, but they haven't really gotten services. So I think there's a need to be met, but I'm hoping the need can be met without using force. And in that regard, I want to at least put on the table a couple of possible resources for you and for all of us. One is something the client movement has talked about in the past, and that is advanced directives. For some people, that you get them in a place and you work it through, and the details of that are important, of how you make that work, but that's a resource. Something else you may not know about. There's something that has been implemented in San Diego County called in-home outreach team. Basically, it does kind of village or MHSA-style outreach that you do on the streets using peers to go to people's houses. And I recently heard a presentation on this at the Planning Council by a mental health board member from San Diego, and he was talking about how they went out to this one guy and he wouldn't talk to him. And then they went out and he talked to him through his bedroom door. And a few more times finally he opens the door. Now he's in services. And this is someone that would never have been reached before. And I want to commend Alfredo Aguirre, the director of San Diego, and his medical director,
Alfredo.
Marcia Lewis. And I suggest you might talk with these people, because this program does a lot of what Laura's Law does without the force. Because, and I'll wrap by saying this, one of the things about Laura's Law is, you hear these stories of family members saying, I've got this person living at home, and they go to the county, and the county says, well, you're just a family member, you don't have any standing, go away. But with Laura's Law, they go in and you say, I have this person living at home, da-da-da-da, and they have to investigate. They have to go in, and then they get the court order, et cetera. And I thought, well, gee whiz, because I actually kind of independently thought of the same idea, and I was pleased that San Diego was doing it. Why couldn't you have a situation where this family member goes to the county and says, I need help, and instead of sending a judge and someone, that whole process, send an outreach team with peers that have been there themselves?
I love it. I love it.
Thank you.
I love it all. Thank you, Steve. Hi, Kristen.
Hi, Darrell. How are you?
Good. How are you?
Good. Kristen Jacobson, the Alliance of California Autism Organizations, and Autism Deserves Equal Coverage. I first just wanted to add one more thank you in the resume that wasn't mentioned. I represent the autism community, and obviously we're a part of the mental health community. And one of, for us, one of your crowning achievements was the passage of SB 946 last year, which is now coming into effect to bring behavioral health services to individuals with autism, which is just critical treatment. And so just want to thank you for your continued support of the entire mental health community and the autism community as a part of that.
Thank you.
So that's my thank you.
Thank you. It wouldn't happen without great advocates.
My comment or question for you is, as we move into selecting benefits for and implementing the Affordable Care Act on the mental health side and for Medi-Cal, do you have any vision that you would like to share with us, and any advocacy that we can do to help you get and accomplish your vision for what you'd like to see, and in how we might use the Affordable Care Act to achieve more parity on the mental health side of things.
Yes.
And then
Including autism.
Including autism, but
Yeah.
just mental health in general.
Well, yes. I mean, I'm kind of a meat and potatoes person. I mean, and I'm not the expert in all the funding streams. Once I, get in it, I learn it, and I've got great people like Diane Van Maren who really know it. But what I've said, what Diane and I talked about yesterday, when I've said to my staff and my colleagues, is I do want to set a goal of X $100 million. The X is deliberately blank because I'm warned not to overreach here. But X $100 million to fill the holes, the patches, to invest, and maybe Steve had it exactly right. Maybe it all ought to be focused on the family members who are frustrated with the fact that they can't get help for their loved one. Maybe that's what it ought to be. And then we figure out inductively then how we get those resources through greater flexibility within the ACA, through the realignment dollars, through other potential matches that we haven't thought about. So that's, I got to, I'm the politician here, so I got to keep my eye on the big picture. It would be great, it would be good but not great if we did get more money through a lot of internal workings, but nobody kind of knew about it or knew that we were actually investing the money, into the system. So, yes, I have a vision. I want more money for the things that work and for the unmet need. And we know what the unmet need is. We know what a lot of the unmet need is. On autism, I would love to expand ABA and our 946 to kids on Medi-Cal, on the public health programs. And we're working on this. It's tough because this is a pure financial issue. And but we're working on it, and we have some creative ideas as well that Diane and I are working on, but no answers yet.
And then I just wanted to share one positive story for you, because you
Please.
said you wanted to hear the positive stories.
Yes.
So my kid's story is a huge success story for early intervention, and it raises one opportunity to potentially, a tiny portion of the third of the third of the third that you talked about could have a really big impact, and that's the Early Start program. I think a lot of the health workers would say that was one of the most devastating cuts, was the restriction on eligibility to Early Start in 2009. And my 3 kids are huge success stories of having gone through Early Start. Every single one of them had Early Start. We had issues of speech delay and cerebral palsy and motor delay and autism and emotional disturbance. And Early Start made an amazing impact for every single one of my kids. None of them is a Lanterman client. None of them need services from the state right now. And they were Early Start success stories. But under the current eligibility since post-2009, none of them would be eligible for any services because they had a single domain delay in speech, and that's all they had. And those 3 success stories, which saved millions and millions of dollars to the state, and many kids like it. So the savings was $15 million. That was the entire savings to change the Early Start eligibility. And I think the cost of even 10 or 20% ending up in Lanterman because they didn't get those Early Start is billions. And so that's a little pocket with huge success. I mean,
Sure.
They saved my kids, and I am so grateful to my social worker and the services that I got from the Lanterman Act, and I want to share those stories.
Thank you, Kristen. I will say, Kristen, I didn't know you would be here today, but it's instructive because talk about another ground for coalition building, the autism advocacy community and the mental health community. I mean, we're talking about the brain here, right? There's huge potential here because the mental health advocates are tremendous. The autism advocates, the parents, are unbelievable. We would never have gotten 946 done if it hadn't been for Kristen and a band of parents who insisted that insurance companies do their fair share to provide help for their kids. And so I hope you guys go off and summit together somewhere and figure out how to build the forces. Good. Eduardo, hi.
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 Thank you, Darrell, for bringing so much important work here and also nationally. I was in Washington a couple of weeks ago, just after you were, and was able to give a presentation at SAMHSA about the structure of the MHSA and why we're so supportive of it as a mental health community and as clients, advocates in particular. I think that there's an important issue that you brought up here. One thing I just want to clarify is that what you've stated about the involuntary outpatient commitment programs, 1421 Laura's Law, is actually already still the case with regards to the previous DMH regulations, which is to say, am I not incorrect, that an involuntary status does not preclude anybody from...
It's unclear, I think.
Okay.
At least it's unclear.
Well, so, but my point is that when we talk about involuntary outpatient, when we talk about hospitalization and things like this, we really need to connect that to your vision around prevention and early intervention, and in particular, I think, stigma and discrimination.
Yes.
So, some people know that I survived a couple of suicide attempts, and one of the things that I remember thinking very clearly was, is it more dignified for me to kill myself today or to become a mental health patient? We have to acknowledge that out there in the community, for many, many people, no matter, they don't know us, they don't know the good work that people here are doing. They think going to the hospital is the worst thing that can happen to anybody, becoming an identified mental patient. So we've got an important opportunity to say, stigma is not just about people thinking right. Stigma kills. And if we can change that,
yes.
If we can focus on alternatives and saying, hey, you have a right in your community to a full range of services that go all the way up to the least desirable place that you pointed out in which people are involuntarily committed for one reason or another. So I'm saying this partly because I think I'd like to see some legislation clearly articulate that if we're funding more inpatient hospitalization, if we're looking more towards funding involuntary programs of any sort, we are building in funding for all the alternatives that get up to that crisis point. Support people at every point of acuity, whether it's having a bad day or really being at the point of wanting to kill yourself.
That's really well said, Eduardo. Thank you. And that's exactly right. That's why it's so frustrating to me that this issue on this end becomes the issue when we're not doing nearly enough, we're not doing enough to help people never get to there. I get that. I'm with you. I don't want it to be the darn distraction that it is anymore. I want to move beyond it and get more people involved in saying we need more funding for all of it. Whether I'm right or wrong, that's my motive.
So insofar as we move legislation, can we get your commitment to say we're going to fund a full range of
yes.
sub-crisis services?
Yes.
Peer respite, everything, until, and thinking completely that hospitalization is the last thing we want.
To the best of my ability, okay?
Thank you
you all. I think I need to probably more. I could probably take two more, and then I think I need to get back.
Senator Steinberg, Chris Stoner-Mertz from the Lincoln Child Center, and all I have to say is, wow, put me in, Coach. You're incredibly inspiring.
Well,
so
thank
you.
Thank you.
I have a question about and watching AB 109 and how that is impacting at the county levels, and how much advocacy seems to be required to get mental health seen as part of that picture.
Yes.
And I love what Eduardo said, because I think there are also people who would rather go to jail than be seen as mental health clients. So I'm interested in your thoughts on how we work together as a coalition with folks who are working on that in the criminal justice system and really shed light on the mental health issues as well as the racial disparities that go on around, around the criminal justice system.
It's interesting with the law enforcement community because in some places and in some contexts, it's adversarial over funding. And then in other contexts, you have people like Sheriff Baca, who was one of my inspirations and Rusty's for getting started in this in the first place, because he was the one who was publicly stating that LA County, the LA County Jail is the largest mental health facility. It's not a cliche because everybody says it, the largest mental health facility in the country, and we have to do something about that. And so I think we definitely need to bring the law enforcement community into this funding discussion. We must, because number one, they're powerful politically, and number two, the good ones really get it, and they get that their jobs are much less effective if we aren't investing up front in prevention and early intervention. So I think, I've begun talking to them, and as we pull together our X funding strategy, they have to be an integral part of this.
Thank you.
Thank you. I can go two more and then.
Well, first of all, I want to thank you for your commitment and I think all the advocacy that you've done around mental health. I also want to thank you for mentioning when you're talking about ADA the need to focus on those folks who are not going to be covered. Because that's also very, very critical.
Yes.
At the same time, one of the questions I have or comment is that I'd really like to see, given the information that we have about who is now eligible under ADA and the ethnicity and the breakdown that we know about that, if there could be a commitment to look at that as a starting point and developing models and strategies that are congruent with those populations. Again, the vast majority of who are communities of color, and then a large number of those will be Latino. And obviously we know that perhaps our current strategies may not be as successful with those populations. If not, I'm sure we would see a lot more parity. But perhaps as we move forward in this process, if there could be a strong consideration for looking at that as a possibility.
In fact, we held the Select Committee on Autism and Related Disorders held a multi-hour hearing on this very subject, the disparities issue. And your suggestion of how we approach the potential, and I say potential, of some Medi-Cal expansion is going to be done in the very context that you described, because you're right, there is a disproportionate impact on kids of color who aren't being served. Okay, thank you. Last one.
Senator Steinberg, I'm Jerry Wingard from Riverside County.
Hi.
Good morning. This year I get to speak for the Mental Health Directors Conference, so I'll take advantage of my position here. I want to thank you for coming, making time in your schedule to come. This is excellent. It's a great time. I'm glad to see you. We are all glad to see you. And I got to say that in terms of your proposal that you're putting forth, we are working at it. We will. You've changed our world over the years. You have really changed our world since the beginning of my career with Sandy. Things are completely different. And had it not been this way, I probably would have quit a long time ago and gone to retirement or something. But I want to thank you for that. We will do just about anything we can to help you with the code. And I just want to throw out one small thing about it, and that is the 5150 law has been outdated for years. It's been many, many years. We've put our heads together trying to figure out how to fix it. And the complications in California counties make it very difficult to fix. So we need to do this again with you. We need to have something that works in Mariposa County as well as Riverside County. And that's a hard thing to do, both rurally and urban. It's that law that we've got to figure out how to make it work right for our world. And it's very difficult to do. We're not the only voice. You know that very well. It's sort of the whole court system and the incarceration system is just as loud a voice as we are. So thank you.
Thank you. Thank you all very much for having me. Sandra, thank you. Thank you.